This is Dr. Chris Robertson providing an overview of lung disease and ACOS. With regards to lung disease, you have two categories, obstructive and restrictive. Course content will focus on obstructive lung disease. However, I want to mention restrictive. People with restrictive lung disease can't fill their lungs with air, and therefore they have difficulty fully expanding their lungs, and lung volumes are reduced. This typically results from conditions that cause stiffness in the lung themselves, stiffness of the chest wall, weak muscles, or damaged nerves. And this can be interstitial lung disease such as idiopathic pulmonary fibrosis, sarcoidosis, which is also an autoimmune disease, obesity, particularly obesity hypoventilation syndrome, scoliosis, or certain neuromuscular diseases such as muscular dystrophy or ALS. We're going to focus on obstructive lung disease. And this is where people have difficulty exhaling the air from their lungs. So they have impaired expiratory flow. And this is normally due to some type of condition that has damaged the lungs or narrowed the airways inside the lungs. And the most common causes are COPD and asthma, also cystic fibrosis. COPD is irreversible, whereas asthma is reversible. That is a distinguishing characteristic. When it comes to asthma and COPD, understand that they are two very different disease processes. And when you have a patient that your concern is this asthma or is this COPD, you are mainly going to distinguish that based on clinical history. Neither asthma nor COPD are diagnosed using spirometry alone, although those are extremely important diagnostic tools with them. History is extremely important. They do have medications that are used to treat both asthma as well as COPD, but the treatment approaches vary, so it's important to also understand that as well. You do have a very small percentage of the population that has asthma COPD overlap syndrome, also called ACOS. Here is a table that gives you perspective on some of the differences between asthma and COPD, particularly things that will come up during the history. So onset differs. There are variations in some of the triggers. You'll see asthma has more allergens, whereas COPD you tend to have more history with cigarette smoke or occupational pollutants. When it comes to symptoms, asthma symptoms are variable, whereas COPD is slowly progressive. We already talked about the reversibility. When it comes to inflammatory markers in asthma, you primarily see eosinophils, whereas in COPD, there are more neutrophils. From a pathology perspective, asthma, there is airway remodeling. However, there is no lung tissue destruction. Whereas in COPD, you have both. You have airway remodeling and lung tissue destruction. And with COPD on imaging, you may see emphysema. And that concludes this segment.